Castle Point and Rochford Health and Wellbeing Strategy Reset Mental Health Workshop from the 9th of September 2020, facilitated by Sam Ball, who is from the CCG Mental Health Commissioning Team. 3 key questions to pull out. From a clinical commissioning perspective, the CCG is geographically aligned to Southend, Castle Point and Rochford. There are 3 things that would be really valuable to pull out to help enrich the mental health part of the strategy. 1. What is the character of Castle Point and Rochford? 2. Who are the key players who are doing things that are making a difference around mental health that people are working in mental health would need to know? For example, the way volunteers were mobilised during the COVID-19 pandemic. This tells us something about the community fabric. These things are assets that help people stay well and prevent them becoming mentally ill in the first place. 3. Who are the unheard groups? Who out there is not okay, despite on average Castle Point and Rochford being socioeconomically okay and health opportunity-wise being relatively okay? Mental health strategic drivers. The NHS long-term plan speaks about thresholds to access secondary care and mental health services getting higher and higher. This is owing to services being organised in silos driven by diagnosis rather than need, and because of demand outstripping resource. The long-term plan talks about how we can change that and create more capacity with investment to transform mental health services. Integration. This is freeway between health and social care, but also between mental health and physical health. Primary care networks and social prescribing link workers. These are our locality delivery framework around which to hang services. Community voluntary sector, there are huge opportunities as we transform mental health services to have a more enhanced role for the community and voluntary sector. There are also local priorities. These are explained on the next slide. Local priorities through a health and social care lens. Reflect those nationally. There are high thresholds for secondary care and siloed pathways. For example, in Castle Point and Rochford, for every 5 referrals a GP will make to a secondary mental health care, only 4 will end up being offered a secondary mental health service. Sam Ball explained that this speaks to a number of things: really high thresholds, lack of capacity, it being difficult for GPs to know where to place people, which means wasted time for primary and secondary care practitioners, and a poor service user experience. Large numbers of people managed in primary care, the effects of COVID-19 and anticipated surge. Plans to address these. Integrated primary community care, placing senior mental health practitioners in each PCN in South East Essex to support those who don't meet eligibility criteria for improved access to psychological therapies, also known as IAPT, or the threshold for secondary health services. Sam Ball commented on this saying, "We are placing 9 senior mental health practitioners, 1 into each primary care network in South East Essex, to meet the needs of people who fall between IAPT and secondary care. Redesigning provisions so that it is more integrated with primary care so that it is more needs-led and holistic. An enhanced therapeutic offer in the Recovery College and Wellbeing Hubs. Creation of more coherent preventative offers to support patient flow by allowing people to step down from secondary care and create capacity, as well as changing the way services look." Other determinants to consider are economic, lifestyle and activity, and family and social. What else do we need to consider? What's the 2019 JSNA profiles tell us? From the 2019 Joint Strategic Needs Assessment for Castle Point and Rochford, we know that Castle Point and Rochford CCG has the 3rd highest prevalence at 12.47% of depression and anxiety in people over 18 compared across that of the other CCGs in Essex. This is similar to the prevalence across Essex at 12.49% and lower than that across England at 13.74%. 21% of residents aged 16 to 65 plus reported feeling isolated from others. This was the lowest percentage compared to that of the other districts in Essex, and lower compared to Essex as a whole at 25.5%. Sam Ball said that what this really tells us is that Castle Point and Rochford does not particularly stand out. We are not a particular outlier according to the statistics, but that doesn't mean it isn't a problem for individuals. Approximately 0.6% of the population of Rochford and 0.7% of the population of Castle Point have a severe mental health condition such as schizophrenia, bipolar affective disorder, psychotic depression, or another psychotic illness, as recorded on General Practice Disease Registers in 2017 to 18. This is below the Essex average at 0.8 and the England average of 0.94. The estimated prevalence of any mental health disorder in children and young people aged 5 to 16 years is 8.89 in Castle Point and 8.24 in Rochford. Both are below the England value at 9.23, but Castle Point is higher than the average prevalence across Essex as a whole at 8.71. Improved access to psychological therapies, also known as IAPT. Therapy for You is the NHS commissioned psychological therapy service used to treat common mental health conditions like depression and anxiety disorders in South Essex. Therapy for You sees roughly 5,000 to 6,000 people a year alone in Castle Point and Rochford, and more than 50% of those recovered from their depression or anxiety. COVID-19 has had a significant impact on the number of people being referred to IAPT in the last 6 months. In quarter one of this year, April, May and June, referrals to IAPT fell well below the target numbers, but has surged back up already beyond the planned levels. Sam Ball explained that IAPT is a busy, effective and well-organised service. Around quarter one of this year, people stopped coming to the services. They stopped seeking help for mental health problems, but it has surged back up already. Age and gender comparisons. Men are underrepresented in IAPT. Women far outweigh men seeking help in terms of psychological therapy. People over the age of 65 are also underrepresented in IAPT. Sam Ball explained that when we think about early intervention and prevention and the well-being of the population, we need to consider these facts and how we make it okay for men and older people to reach out for help. Sometimes it can be generational that people aren't comfortable having that kind of conversation. We need to address this and reduce that stigma. Questions to consider. These are the questions we need to consider. 1. What does this data tell us? 2. What do you think are the key priorities? 3. How should we be addressing them? Let's also revert to the other 3 questions mentioned at the beginning. 1. What is the character of Castle Point and Rochford? 2. Who are the key players doing key things that will help with mental health and well-being? 3. Who are the unheard groups and individuals who might not show on the statistics because generally in Castle Point and Rochford things are okay. PHE Prevention Concordat. This is a national movement focusing on the promotion of good mental health and prevention of mental health issues at a local level. It aims to facilitate local action, creating resilient communities by taking a prevention-focused approach. Our Health and Wellbeing Board has developed a series of shared commitments focusing on cross-section action over 5 key areas of work to become a signatory. Our commitment plan will be submitted to Public Health England when the next submission waves open later this year. This date is to be confirmed. Sam Ball commented saying, "This is a commitment for everyone to pull together and is a key part of the health and wellbeing strategy for Castle Point and Rochford. It speaks to the opportunity to be more preventative and think about those community assets and key players." Comments from the discussion. Matt King said, "The investment at the moment is in primary care and mental health, and we at Trust Links are just about to pilot a support worker role based with the mental health nurse in the Canvey PCN. This will be a voluntary sector support worker who will provide a bridge through to the voluntary community sector services and also provide some targeted interventions for those who are struggling to access services, perhaps aren't at the level to need secondary mental health services." Nick Chard said, "Looking at the current strategy, it only talks about the severe mental health disorders. We talk about more demand than resource available and prevention. That high-level mental health is only the tip of the iceberg. We need to make sure we include preventative lower tiers, i.e. community therapy and statutory IAPT services, which prevent people reaching that high-level mental health issue in the first place." Candice McPherson said, "I do feel that the early intervention and prevention element is missing in the current strategy. It is quite high level, but what about everything else?" Sam Ball said, "Building a prevention pathway is an explicit objective, and pulling out the role of the voluntary sector and having a clearer, bigger role for the voluntary sector is an explicit plan. The feedback is that we need to reflect that in the health and wellbeing strategy. Sam Ball also said, regarding the point about social isolation, is there a specific need for a population because of how rural it is? Are there people of transitional age who are in danger of missing out on services because of where they live? Matt King responded to this saying, with COVID, we've all gone digital, so people are accessing more if they are digitally literate, but there is digital isolation too if people don't have access to the internet or aren't very good with technology. Transport to access services is also an issue, particularly in Rochford districts like Great Wakering, and for some Southend becomes your main centre because of the geography and where the town is. The issue with Canvey is the issue of access off the island to access services, and also greater levels of deprivation and intergenerational deprivation on Canvey. We also need to mention young people's mental health, even in affluent areas, is a real issue. School pressures placed on children to perform and achieve, self-harming, anorexia and anxiety is probably a ticking time bomb. Nick Chard said, the children with anxiety now are the mental health patients of the future, so we need to make sure they are properly spotted now to prevent that future need. Candice McPherson said, my role is specifically more focused on early years and young people, and I do find that I have to really push that best start in life element of the health and wellbeing strategy, so I think that is something to consider. Councillor Johnson said, the problem with a strategy is how deep do we go in a document that makes it still readable and something that someone can pick up and understand. My fear is that if we start delving into something too deep, then this becomes uninteresting for the people who need this and need to understand what is out there for them. The key themes from this conversation are isolation, be that social, rural or digital, the role of the voluntary sector, greater emphasis on early years, and children and young people's mental health. Next steps. To meet before the next board meeting to continue discussion and develop the narrative around this priority for our new strategy. Is there other intelligence you can share to inform and provide more insight? Who needs to be involved and how? What other actions would you consider necessary to help drive forward our Prevention Concordat commitment plan?